Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Dr. Liz Della Severa, Vice President and Chief Medical Officer for MedStar Ambulatory Services. She's also the Medical Director for the DC region of MedStar Health Primary Care Sports Medicine and a team physician for the Washington Capitals. Thank you so much for being here today, Dr. Della Cabrera. You're quite a busy woman, and I'm glad you could take the time today to talk with us.
Thanks, Karen. Happy to be here.
Yeah. So today we're going to talk about how you can use online health information to ask questions and have a more productive conversation with your healthcare providers. Dr. Della Cabrera will also explain when online health information can be useful versus misleading and how to talk with your provider about what you've read and how you can get the best care possible. So, if you're tired of consulting with Dr. Google or ChatGPT when you're sick, stick around, share this broadcast with your friends, and ask your questions in the comments below, and we'll answer as many of those as we can today. So, before we get started, Dr. Della Cabrera, can you tell our viewers a little bit about yourself and the great work you do here at MedStar?
Yeah, I'd be happy to. So Liz Della Sabera, I'm a primary care sports and ER physician by training, mostly practice sports medicine clinically now. And I'm the chief medical officer for MedStar Ambulatory, which oversees our urgent cares, our radiology, outpatient centers, our big multi-specialty clinics, as well as our ambulatory surgical centers and radiation oncology. As you said, I'm also a team physician for the Capitals and oversee non-operative sports medicine for our DC region. So oversee a lot of our teams down here.
Wow, very impressive. Thank you
Thanks.
so much. And looking forward to having this conversation today. This is certainly something that folks have been doing for years, going to Google with your symptoms. Of course, now we have ChatGPT, which adds a whole other layer to this. So let's start with the big picture. How common is it for patients to look up symptoms online before coming to see a healthcare provider?
It's really common, actually, especially in like an urgent care emergency setting or somewhere where you see something like an acute injury or illness. It's been going on for a while. It used to be Google or the search engine of choice, and now it's gotten a little more sophisticated, as you mentioned, with things like ChatGPT or other AI search engines. But looking things up online has been common for years, especially in that kind of acute injury or illness setting.
Yeah. And is that causing people to put off coming in or even avoiding a visit altogether?
Yeah, sometimes. I mean, you can get some false reassurance when you go online, or think that you may have the answers, and so you don't need to be seen. It can also have the opposite effect, where it can worry you more, and cause people to go in, maybe even to a higher level of care, or go in sooner than they needed to. Where something could maybe wait for your primary care, maybe they end up going to the emergency department because they get really worried. So it can work both ways, depending on how you ask the question and what venue you ask the question, etc.
Yeah, that makes sense. When we think about Google searches, we know those are a lot different than the replies that we get from a tool like ChatGPT. How are results coming from AI different from the results that are done by online searches?
Yeah, so AI is a little bit more catered to you and a little more interactive. So whereas Google, you could put in your symptoms or a question and you'd get lots of different places that you would need to pull into and then review the data. AI kind of compiles that information and puts it more into an easy to read way, but then also asks you questions or offers different options as a next step. So it caters it more to you and to your questions, and also prompts you with what they might be looking for to help narrow things down. So it, in some ways, it's better. However, Chat GPT and these AI forums are only as good as the type of question you ask and the amount of detail you give. And for non-clinical people, you might not know what's relevant or irrelevant to put in those questions or how to phrase it in the right way. And so you could ask the same thing in three different ways and you may get three different answers. And so a lot of it is how you ask the question and what information you provide to the AI in order to give you those answers.
Hmm. Yeah, that makes a lot of sense. And that experience on something like ChatGPT, it's more of a conversation. So you could be going down the wrong path, perhaps, if you aren't asking the right questions or, yeah, going in the wrong direction. So I can imagine, yeah, it's really important to have conversations with your healthcare provider about what you saw instead of just taking what ChatGPT says as is. So, how do providers generally feel about using Google and ChatGPT?
I'm never offended when patients do that. I think it's natural. It's a part of what we do in everyday life. So doing it with health concerns or questions also makes sense for a layperson or a non-clinical person. I think it's all about how you approach communicating that with your physicians. Um, Saying something like, "I looked this up online. I know I'm not the expert and I know online can be wrong, but online mentioned this or that." That's a great way to approach it with your physician, as opposed to thinking that that's fact when you go in. Um, I think as a physician, I actually want to know what's worrying you as a patient. And often, if you've looked something up, there's something that AI or Google told you that you might be worried about: cancer, heart attack, something like that. And if you're worried about it, I want to know. And so I think bringing it up makes a lot of sense. It's just all about the way you bring it up and how you bring it up in the conversation that allows you to have more of that good dialogue with your provider.
Yeah, that makes a lot of sense and glad to hear that. It it sounds like something like ChatGPT or a Google search could be a good starting point for you. What when we think about the increase in AI in particular, have you noticed an increase in people looking online using AI as a starting point before they say come into an urgent care or see their primary care provider?
Yeah, I actually think it's led to maybe a decrease in volume in like an urgent care type setting because a lot of things that people might have come in for, they feel like maybe they got the answer online or through the AI source they were using. It does worry me a bit because, like I said, it can take you down wrong paths depending on how you ask the question. And ChatGPT is not meant to be a clinical AI. And so there are limitations to it. I think it's very easy nowadays to do a quick telehealth visit, like we call e-visit, to go to urgent care, and you can validate what you learn. And so I find these online tools to be helpful to give you a framework, maybe to help you understand where to go, because sometimes you don't know where to go for a certain type of complaint. It's also helpful for things like, um, what's a good cold medicine I could take if I have high blood pressure? Like a very specific type question like that. It can be helpful for something like that. But when you have symptoms that you're worried about, I think it's important to use providers to validate what you learn online as opposed to fully trusting it implicitly, because then you can get yourself maybe into trouble by going in too late, or by going down the wrong path.
Yeah, that makes a lot of sense. Trust, defer to the experts that can help assist you and support what you're seeing or tell you otherwise. So,
Yeah, I've actually used some of these AI tools with things I 100% know the answer to, whether it's clinical or non-clinical. And I would encourage people to try that in your own field of expertise. And you'll realize that it gives you wrong answers.
mm,
Um, and so once you start to see that, then you realize you have to take everything with a grain of salt. There are things that it's definitely right about, and a lot of what it says is correct, but there's portions of it that are incorrect. And it really is all about how you phrase the question. So if there's something you know really well, then ask it, and ask it in 3 different ways with kind of uh, probing or prompting ways that you ask it, and you'll see that these search engines and or AI tools will give you different responses, and you might find things that are incorrect. I know a lot about the Capitals, so I can ask questions like, how many goals does Alex Ovechkin have today? And it's usually off by about 2. So
Mhm.
there's those kinds of things that you can ask it to see how accurate it is.
Yeah, that's really smart. Yeah, that's a good way of, yeah, testing things out and yeah, take those insights into your conversations with your healthcare provider. So we talked about Google's been around for years. People have been using Google to help I understand symptoms and diagnoses. ChatGPT being a newer technology that especially younger people are using. Certainly, it does cross multiple demographics. But when we think about this being new and our younger generations who are more likely to use these tools, what would you say to those folks or someone who can't go to an urgent care? Maybe they don't have insurance, and so they're more likely to use Google or ChatGPT. What would you share with them?
Yeah, I think that for that younger generation that does have insurance, it's actually really easy to validate what you're reading. So that quick telehealth visit from home, and there's urgent cares on almost all of your blocks. So those are easy ways to validate. Also, having a great primary care provider that you trust, between portal messages and or telehealth visits. It's really good to have a trusting relationship with a primary care. And for those without insurance, the same thing applies. I mean, there are the free clinics where they do accept people without insurance, and so you can have a trusted primary care you can go to, and those clinics also have walk-in hours and visits. So I think having a trusted provider that you can use to validate things, and then if it's something urgent off hours, using things like e-visit and telehealth urgent care is also another easy way to do that.
Thank you very much. And do we have self-pay options for urgent care?
We do.
Is it
Yeah. E-visit and urgent care have self-pay options that you can utilize without insurance. So depending on the financial situation, the free clinics versus self-pay options are all great options for those that don't have insurance.
very good? Thank you. So we've had a great conversation so far, very meaningful discussions about Google and ChatGPT. I just want to take a moment to welcome our viewers again. Thank you so much for tuning in. We are talking to Dr. Della Sabrera about using tools like Google and ChatGPT to research symptoms and what to discuss with your physician. We're here with Dr. Della Sabrera, Vice President and Chief Medical Officer for MedStar Ambulatory Services, and we have more to discuss. So if you haven't already, give us a like, let us know you're watching, let us know where you're coming from. If you have any questions, post those in the comments and share this broadcast. This is very important information. That's why we are here today, something that we have found our patients have been asking about, and something that we wanted to come live on here today to educate you about. So help us spread the word and share that post. So we have some more questions for you as we continue to hear from our audience. When we think about the conversations that our patients would have with their healthcare provider when they come in. You mentioned a couple things earlier, but is there a right or a wrong way for patients to bring up what they've searched during a visit? You mentioned, I researched this. What are your thoughts about that? But can you talk about, yeah, or reiterate what
Yeah.
to say and what not to say?
So the first thing I would say is don't start with what you learned online. I would, start with telling what's going on like you always would to your physician, and the physician being able to take a good history, do an exam, and do whatever testing they would want to do. You don't want your physician or your PA, NP, or provider to anchor on a certain thing or focus on one thing that you found online instead of staying broad and thinking about everything holistically. Um, I like I said before, I actually do like to hear what my patients come in thinking is going on based on what they learned online or what's worrying them the most. And so I tend to ask those open-ended questions. Is there anything you didn't tell me? What's worrying you about this? Have you done any research? What do you think is going on? So hopefully your provider will ask those kind of questions. But if not, if you're not prompted, please bring it up if it hasn't already come in the conversation. But it's all about how it's brought up and when it's brought up. So I think not at the very beginning of the conversation because it can actually sway the direction of your visit, and that could be less helpful for making a correct diagnosis. And the second thing, just presenting it as I always know things can be wrong online, and I'm just bringing this up because I read about it, wanted to get your thoughts. So it's that collaborative discussion about what was found online as opposed to thinking that it's always accurate and right and swaying the conversation in that direction.
That makes a lot of sense. Thank you so much. And are there situations, we talked a little bit earlier about how these searches can be beneficial. Can you talk about the difference between acute symptoms, chronic conditions? Are there certain situations where those type of searches can be beneficial depending on the type of symptom or the type of condition that you're searching for?
Yeah, I think asking very specific questions is important. I gave the example of, will this cold medicine elevate my blood pressure? Can I split this pill that I have in half, or does it need to be taken whole? Like little things like that can be helpful. How much Tylenol can I take, in over an 8-hour period? This is my weight. That kind of thing. It can be helpful. I think when you're asking, especially about a chronic condition that has so many elements of complexity to it, because if you have a chronic condition, there's likely been a lot of tests, many different providers that have seen you. And those test results, whether positive or negative, are extremely relevant to giving you the correct information. And for the patient to be able to collate all that information into a good clinical question is difficult. The
Yeah.
other thing is, again, ChatGPT isn't as clinically smart as you would think it would be. And so those kind of chronic complex things are not the right forum for that. The other type of question that is fairly helpful that ChatGPT or something like that can be helpful is where should I go for a certain type of symptom? I have a sore throat. Where can I go today near me? Um, Trying to direct patients to the right level of care is sometimes really challenging. We see people that go to the emergency department when they could have come to urgent care. We see people that use e-visit from home when they actually should be in the ER. And we can always get people to the right place at the right time. And that we can navigate people, but sometimes it can be helpful with telling you where to go, like what type of location could this be managed from home versus do I need to be seen in person? Is it ER versus urgent care? It can be helpful for those kind of questions as well. So very like simple, straightforward questions. Chronic conditions with lots of complexity, it's not going to be the right forum for that.
Thank you. Yeah, that makes a lot of sense. The chronic conditions too, our providers talk to each other. So if you have, have a multidisciplinary approach. So if you're managing diabetes, you might have other care team members that are helping you with that. So that's not something that ChatGPT would be doing, having those uh, internal conversations about a particular patient from different specialties. The Yeah, the symptoms piece you mentioned, the sore throat. I personally just went through the exact thing with I was not feeling well and I had a sore throat. Uh, I ended up at an urgent care getting a strep test that was positive. And I had a great experience with MedStar Health Urgent Care. And it started with really just trying to understand what I should do, knowing that I likely had a need for a test and a prescription, those kind of things. So that makes a lot of sense as a good tool to help you know where to start. Because yes, there are so many. We have options now, and especially with e-visit, if you can have an e-visit, that's great. If you are unable to get somewhere in person, but not all the time does an e-visit make sense. You might need to go to urgent care or and then follow up with your primary care provider. So that's why we help navigate as best we can internally, but certainly using tools like ChatGPT can help you as well.
Yeah, and to your example, it sounds like it directed you to the right place because you needed a
Yep.
test that can't be done online or virtually, which then led to an antibiotic treatment, and a change in management as opposed to just kind of dealing with it at home with over the counters, et cetera.
Hmm.
So that's a good example of using it to figure out where you should go and why sometimes you need to be seen in person because there's a test that you need to use to validate or to unvalidate a diagnosis.
Yep. Exactly. Do you find that online information can unintentionally increase someone's anxiety, even if they're trying to be proactive? I would imagine, yeah, especially if you're going down the wrong path and you end up in with the wrong diagnosis, that could definitely increase anxiety. But can you talk about that aspect of it? You're trying to be on top of things, but then you come out feeling even more stressed.
Yeah, for sure. I see that a lot. I mean, because many of the pertinent negatives or information that would put scarier things much lower on a list as a physician that I would generally ask about, that kind of interactive questioning is not clinically savvy with things like ChatGPT. And obviously, with Google, there's no back and forth. So let's give an example of just a simple lump or bump. A lot of times we get lymph nodes that are swollen after a strep infection. Use your recent example. And
Hmm.
you can get some swollen lymph nodes from that. If you felt a swollen lymph node in your neck and you put that into ChatGPT or Google, a lot of things about cancer may come up. Um, that tool isn't going to know that you are young, healthy, don't have weight loss, just had strep throat,
Hmm.
um, that it's a tender lymph node after an infection, that's mobile, all the questions and things that as a physician we would be able to ask and examine and give you reassurance that actually no, this is normal and it's going to be okay. But if you put that online, you might be worried you have cancer, and so then you come in panicked, wanting to get more tests, ultrasounds, blood work, et cetera, that you might not need. So that's a kind of example where we see patients get a lot of anxiety when they um, use these tools without giving all the information, and the tools probably have some safety built to them to give you the don't miss diagnoses or the worst case scenarios, and so those are going to be there regardless, and so it definitely can scare people.
Hmm. Yeah, makes sense. I have on the Google side have my husband does use Google a lot of times, and yeah, I feel like it's either yeah, go to urgent care or you have 2 days to live. It's just it's so it can be very extreme sometimes.
Yeah, for
um,
sure, for sure. So we definitely see patients that have anxiety from looking online, and if you do, that's okay. Just use that's a perfect example of using eVisit or using your primary care provider, um, you know, and or urgent care to help you understand what's going on and hopefully bring down that level of anxiety. Or if there is something to worry about, get the right test that you need to help you get the answers.
mhm, yep. So we talked a lot about information that you might find online that you would bring to your visit. Is there other information that is helpful for patients to bring to their appointment? So, as their provider is discussing their symptoms or diagnosis, whether they found this information online or not. From your perspective, what information is helpful from the patient?
Any prior testing or records that you've had that might be relevant to this diagnosis, and now with patient portals, regardless of the healthcare system, those are usually easy to find. So if patient is coming in to see me for a recurrent sore throat, again, Karen, using your example, if you've had strep before and what those test results have been, what antibiotics you've been on before, if you've seen an ENT before, any of those kind of records would be helpful. If you're seeing a doctor for knee pain and you've had an X-ray before, bringing that in, that just means we don't have to repeat testing and we have the full picture of information in order to make the best diagnosis. I think if you've looked up stuff online, printing it isn't that helpful necessarily, but it's not harmful. Again, if you're worried about something and you feel like you're not going to remember what you read online, um, I always want to relieve those concerns or answer those questions. So feel free to bring printed information if you feel like it would be useful to have in order to communicate what you're concerned about with your physician.
All right, thank you very much. Have a question from our viewers about privacy. When we think about ChatGPT and Google, you're putting your information in there about what health symptoms you're having, diagnoses. Any thoughts on the privacy aspect of all of this, especially when it comes to healthcare and using AI and Google for symptoms and healthcare questions?
Yeah, I'd say none of that stuff is private, and so you shouldn't put any of your own personal health information online. I, as physicians, we don't use things like ChatGPT or other AI tools with any sort of personal health information embedded. We we're very concerned about the privacy aspect. So anything that you're using online, you just have to realize that you have to be okay with it not being private. I think most people are asking more generic questions, maybe not things that would be identifiable to them, but it's always definitely a concern.
Yep, thank you for that. And then another question, when we think about how quickly ChatGPT is growing, these tools are changing very, very quickly. Any thoughts on what the future could look like with AI in healthcare and how patients will continue to use it and physicians will continue to use it?
Yeah, I think it's going to be a great adjunct tool for the healthcare for providers. As it gets there's going to be more clinically focused ones. Like there are ones already out there that are much more clinically focused. And as those get savvier and savvier with research and other health information, it's going to be a really nice adjunct for physicians and providers to use, in particular for really complex cases. So there's things that are simple that we see every day, and we know the answer, and the treatment generally works. But when people are more complex and it's something that's outside the box, using AI to help us think about what are we missing or what would be next steps, and then obviously using our clinical acumen to determine if that's correct or incorrect, it will just be an adjunct to what we do. I also think separate from that, it will be a great adjunct to make us more efficient. So we're already using things like AI scribes, so we can have our notes, complete or virtually complete when we leave patient exam rooms. So we aren't going to be bogged down sitting at a computer, but can be much more interactive with patients, talking to them eye to eye, thinking about what's going on, as opposed to putting everything in the computer. Same thing goes with being able to find information out of your healthcare records. So if there's stuff that was from 5 years ago on a CT scan, and we just got a new one, being able to know was that there before quickly, and compare. So right now we have to kind of scroll back through and look at old scans, but being able to compile information that's relevant to you at that moment and have it presented to us forward facing will allow us to spend less time at the computer looking for things and more time thinking about you and interacting with you.
That makes sense, and that's really exciting. Um, all right, thank you. Yeah, I think the future will be here sooner than we we realize with how quickly the technology is growing. So I have some more rapid fire questions for you. So when we think about using tools for your symptoms, waiting perhaps to go to an urgent care or go having an e-visit, you're just doing your own research. When you think about the types of symptoms that patients are putting into those queries, which one or ones should never be ignored or waited out because based on a an online search? I can think of one, probably a heart
Yeah.
chest pain. But yeah.
Yeah, I mean, there's so many, it's like hard to know which one to choose, right? Uh, So, and of course, if any of these are chronic issues and they've been worked up and they're still continuing to be worked up, that's a little bit of a different story. But if you're acutely vomiting blood, if you acutely have, a lot of blood in your stool, if you're acutely confused, any sort of acute neurologic change, like things go weak or numb or speech changes, chest pain, um, acute shortness of breath, those are all things that you don't want to ignore. There's too many to name, honestly. Like I don't want,
Yeah.
it's impossible to be all inclusive. But those are some of the big categories of things that you don't want to just go online and wait it out. Those are things that you want to acutely be evaluated for. It doesn't mean that all those things are emergent and or are going to end in a bad or dangerous diagnosis. Sometimes chest pain is reflux, right? Sometimes numbness in your arm is actually just is a pinched nerve in your wrist, like a carpal tunnel, or in your elbow. While those things should be addressed, they're not acutely dangerous. But that's our job, is to rule out the other things and to rule in the less serious diagnoses. And so it's really important to be seen and checked out in order to figure out which way this is going to go.
Yeah, makes sense. Thank you for that. What would you say is a one of the biggest myths that you see from online symptom searches?
Uh, well, I think there, like I said, there's two ways you can. I'd say sometimes you can get too much false reassurance, but I'd say even more so, you get the alarmist results or concerns. I find a lot more anxiety from online searches, and so I think the biggest myth that people might have out there is that it's very accurate. And so there's things on both sides of both sides of it. It can cause more anxiety because it's a little more alarmist than it should be, or it could give you some false reassurance. So I think the biggest take home here is use online for very specific questions or as a starting place to figure out where to go. But use healthcare providers to validate and or to reassure in some cases what you have read.
Thank you. Yeah, that answers my other question. Because yeah, if you're feeling anxious, like we talked about earlier, your provider can give you that reassurance. You want to know what's on their mind and what they're concerned about. Um, are there reliable ways that you would recommend to, other than obviously talking directly with your healthcare provider, but other reliable ways that patients can confirm if the online information that they are getting is legitimate? I would think, yeah, for a Google search, you obviously want to make sure you are going to credible websites like MedStar Health's website. I don't ChatGPT, I don't think really sources as much that I recall. But yeah, any thoughts on, you know, how can a patient, let's say the example where we said use it to help you go to the right place. I don't know, maybe that's not the right example, but how can we help legitimize what they are getting and what we are recommending that they're searching for online? Any thoughts on that?
Yeah, so I was going to say, looking at the sources, there's a lot of non-healthcare based sources, and ChatGPT does source some things. making sure it's credible websites that either come from healthcare systems or, valid research, medical articles, that kind of thing. I keep harping back to being as specific as possible with your question and asking pretty simple but specific questions. I think is the way you'll get the most out of it. When you ask broader questions and or more complex questions, I think that's when you might start to go down rabbit holes that aren't as valid. So I think using it for very specific, simple things and validating the sources is probably the best way.
All right. Thank you very much. So before we wrap up, we talked about a lot of great information, some good takeaways. I think the key takeaway you might have just mentioned, but before we close, I do want to just make sure, if nothing else, that our viewers get from today's discussion. What is that one thing you want to make sure that our patients remember when they're balancing online information and what they hear from their primary care or urgent care provider?
Yeah, a couple of things. One is it's totally fine to bring it up with us. It's just about how you bring it up and when you bring it up, but we actually want to know what you're worried about and or what you think might be going on. So don't hesitate to bring those things up. We all know people are using online tools. Everybody does, and so don't think that your physician or your provider will be upset by that. The second thing is, use providers to validate what you've read. And now we have so many different ways to reach us: telehealth, e-visit, urgent care, patient portals, etc. That I think we can help either if you're anxious about something, help to reassure you and or help to get the test that you need, and help to validate or invalidate what you've read online.
All right, thank you. That is a great takeaway. Well, that's all the questions that we have for you today, Dr. Della Sabrera. This was very helpful. I hope our viewers enjoyed the information and learned something today. I certainly did. Thank you for spending time with us.
Or
And thank you to our viewers for tuning in and asking your questions. To learn more about the services that we offer at MedStar Health Urgent Care and MedStar Health Primary Care, you can visit us online. We'll share the links in the comments. And with that, thank you everyone for tuning in and have a great day. We'll see you next time.
Thank you.